Hello, everyone, and welcome to another edition of the Health Forum. My name is Carl Messina, and with me today I've got Dr. Young-Soo Kim,
Yeah.
who's biomedical. How are you, Dr. Kim? How's everything going?
Yeah, you look better and better every day.
Oh, I'm trying. I'm certainly trying.
Yeah. You know, we recorded our last session 2 weeks ago, and which is about autoimmune diseases, and
Yes.
we didn't finish. So today, let's finish the discussion about autoimmune diseases.
Okay, let's just do a recap on autoimmune
Yeah,
diseases.
yeah. So at that time, I said I'm going to win the Nobel Prize, and you laughed. I remember it's recorded. And then you are not the only one who laughs when I say so. So this morning I talked to Dr. Kuipers,
Yes, Dr. Marcus Kuipers, yes.
I, and I said the same thing. And he laughed too. But I was recording on video. I told him, let me convince you with reasons, proofs, and logics. And around the end of this conversation, he says he's convinced. And what I'm planning to do is I'm going to interview doctors after doctors, experts, famous scholars in the area, one by one. And I'm going to add in the beginning, they laugh. I just record that. After the conversation, around the end of conversation, they say, I'm convinced. I'm going to add on and on and on to this interview.
Now you got me laughing again. You're going to get that on the interview as well.
See, you laugh, okay? Remember, this is on record, you know. So as I also said, as we are moving from 20th century to 21st century, the major diseases for human being was metabolism disease, diabetes basically. And then from 2020, it becomes a major concern, major health concern for humankind is respiratory viral infectious disease, which is coronavirus. This is going to come again and again and again in different forms, under different names. But respiratory viral infection disease, pandemics is coming. So we should be ready there.
Last time we spoke, Dr. Kim, you and I had talked about most all kinds of ailments originate from autoimmune diseases.
But this viral infection is so dangerous because it leads to autoimmune diseases. So this viral infection triggers so-called cytokine storm, which is just one's own immune system massively attack one's own organ, especially liver, kidney, heart muscle, myocardium. So autoimmune disease is becoming the chronic side of these viral infections. So the same thing. It is the both sides of the same coin. So when I said it's going to be autoimmune disease, the century of autoimmune disease, I say the same thing. Viral infections, other than bacterial infections are less and less frequent. But once it happens, it becomes a super bacteria these days.
Yeah.
Anyhow, let me recap briefly what we discussed. Let me just use the analogy I used last time. Autoimmune disease is something like when a burglar breaks in your house, you call police. Police came, the burglar left, the police doesn't go home, doesn't go back to the station, and police just keeps on shooting even after the burglar left. So when we have a certain attack or a certain inflammation or a certain invasion from outside, our body mobilizes immune system, which is equivalent to calling police, and it doesn't leave, and it just keeps on creating more inflammation, and inflammation leads to more troops, more policemen, and then when it comes in more inflammation, that's autoimmune diseases. And I just mentioned that there are so important, so many misunderstandings regarding this. And then the major misunderstanding is, at first, doctor says it's rare. No, it is not rare. That's the first misunderstanding. Second misunderstanding I mentioned was, doctor says they don't know the cause. And what I say is, we don't have to know the cause, because we go back to normal life. We don't have to know the cause. But doctor says, oh, there's no cause. I know a few, but I say it's foolish to focus on the cause while we have simple ways to go back to normal life. And then doctor says there's no cure. Yes, there are cures. So there are a few misunderstandings, and then my argument, my theory is a lot better than theirs. That's my position. What is the best doctor? Who is the best doctor? Tell me, who is the best doctor? A doctor who cures you every patient. So if the cure rate is 100%, he must be the best doctor, right? Do you agree?
Well, if he can cure 100%, sure.
I say I'm better than them. The reason is I help the patients to realize it was misdiagnosis. So many misdiagnoses. The doctor got it wrong. Okay? I say, according to my experience, depending on, in most autoimmune disease cases, the ratio of misdiagnosis is higher than 70%. 70%.
In autoimmune diseases.
Exactly. So let me just give you one example. You must have heard lupus, right? Lupus.
Yes, absolutely.
Yeah. Lupus is a disease like the symptoms like as if you were bitten by wolf, right? That's why it's called a lupus, right? Yeah. So it says, how do you diagnose lupus? There's no test. It's like this. There are 11 symptoms, and if you have more than 4, you are diagnosed as having lupus. And then let me tell you what are the 11 symptoms. You have a rash on your cheek. You are hypersensitive to the sun, joint pain, ulcer in the mouth, and then protein in the urine, so which is called proteinuria. And then you have a mental disease. You have anemia. These are all common syndromes, common symptoms. And then we ask the doctors, okay, how are these 11 symptoms are related so that if we have more than 4, we are diagnosed as having a certain horrible disease? They said, no, we don't know. We don't know why there are all these 11 symptoms. It is a joke. But as I told you, there is a huge amount of intellectual hubris, pride. So I told you the last time I used a very big college word, eponymous. So the highest glory of a doctor is these days, which is I totally hate, is his name is used to name a disease. Yes. So yeah, somebody's disease. Then that doctor becomes the most gloriously respected doctor, which is wrong. You must have heard Crohn's disease, right? Crohn's disease.
Yes, Crohn's disease, yes.
Yeah. And we ask, how do you diagnose Crohn's disease? What test do you do? No test. There's no test.
There's no test for Crohn's disease.
There is no test by which you decide whether this person has Crohn's disease. So it's like this. Crohn's disease is you have your loss of weight, abdominal pain, diarrhea, fever, blood in stool, and then abscess, which is pus from time to time appears. Hey, I say that's a poor gut health, not Crohn's disease. And then once a person is diagnosed as a Crohn's disease, and doctor says with a very serious face, "Oh, this is a rare disease, 1 out of million, 1 out of 2 million, and there's no cure." And then he gives antibiotics, and if it doesn't work, they just give antibiotics, and if it doesn't work, they say this is Crohn's disease. No, you use the antibiotics to create a resistance to the antibiotics. You created the symptom and you diagnosed as a Crohn's disease. That's a joke. So I just ask them, hey, okay, Crohn's disease, tell me, how do you decide a person has a Crohn's disease? There's no test. This is a joke, right? So that's why I say, if a doctor says, I'm the best doctor because my cure rate of ratio of Crohn's disease is 100%, I say, I'm a better doctor. Because why? I tell them this is mixed.
Well, what about the medication? What about the medications from the Crohn's disease?
Medication come on Crohn's disease. They just give so many medications, and then so they just give steroid. Steroid is like, as I told you last time, steroid is like you just shut down our immune system. So if there's a police brutality, oh yeah, then we eliminate all the police in the city. So that's the temporary. And next time something happens, it becomes serious, more serious, more serious. So I just have a hugely. I just hate the word using the big words, but I don't trust medical doctors on this issue because it's illogical. They don't know how to test this thing. They don't know how to diagnose this thing. But still, they claim the ultimate authority to all these things. How do you know?
So what's the solution here?
Solution.
What's the solution? Let's talk a little bit about that.
Yeah. Solution. Let me discuss the solution in four parts. Okay. One. Gut health. Let me repeat 1,000 times. Gut health. Just that you should do the gut health. Whether you have autoimmune disease or not is important for your health, right? So take care of gut health. And in order to take
care... Would that be with the probiotics, you mean?
Yeah. But let me ask you. People take a wrong probiotics, meaning that they take probiotics from cow. Is that the probiotics you got from your mother? No. You should have your own probiotics which you received from mother to help you fight the bacteria and other infections. And then you are drinking those probiotics. This mother cow gives the baby cow. That's why these days people act like a cow these days. Here's another thing. If you restore the environment, healthy environment,
yep.
The healthy probiotics just flourish itself very quickly. So what I'm saying is using natural means like our product Calimera, or our Calimera is mainly based on celery, the vegetable celery. You eat a lot of celery, If it is difficult, take our product. If you clean the intestine with natural means, then it just creates a very intrinsically healthy environment for probiotics to flourish. That's the best way. And it flourishes very quickly. It just grows very quickly. You don't have to take any outside strange probiotics.
Yeah, I remember you sharing a story about that.
Yeah.
With celery.
Yeah. And next thing I'd like to mention is you have to remove some continuous attack from the environment. For example, just don't be too alarmed. I am 100% convinced that lupus comes from fluoride in our tap water.
Lupus comes from fluoride in the tap water, which you're saying.
That's what I really, because the many lupus patients came to us. I check, please change the water, and then they say, Dr. Kim, it was a cause. So likewise, the genetically modified food, GMO. I told you last time,
Yes,
GMO comes with a huge amount of chemical fertilizer, chemical insecticide, chemical herbicide. So if you attack your body with those kind of heavy metals and toxins, of course you have a problem. Also, lack of vitamin D. So the
now, Dr. Kim, along those lines, you and I have been talking now for quite a few sessions.
Sure.
That we've done here,
yeah.
And I'm starting to realize that what you're saying, even before you start taking products, you've got to cleanse your system utilizing the calamera. What about all of the metal toxicity in our bodies? Would you recommend a cleanse of the metal toxicity as well?
A few things. We have a great product called Catharos, Kathros, but all our products are basically based on foods. So I say, if it is too inconvenient for you to prepare for yourself, buy our products. But the best is you prepare your own product at home. For example, Catharos, our heavy metal detox product, is based on a simple idea. You know what heavy metal is? Tell me what heavy metal is. Which is a metal which is heavy? No, that's not heavy metal. Heavy metal is defined as a metal. If it goes in our body, it goes into the fat, and it doesn't come out. That is the definition of heavy metal. So when it goes in,
what types of heavy metals are more prevalent than others in
arsenic? Arsenic. Yeah. That's
where do we get a lot of arsenic from? Where does the arsenic come from? What types of foods?
Asians, rice. Yeah, rice is a plant, okay? Rice is a plant that absorbs arsenics from surroundings.
Really?
Yeah, especially, worst rice in that sense is California rice. So never eat California rice. The arson is used as a murder tool, right? So the arson, arsen, arsenic contained in the rice is the main cause of gastric cancer, stomach cancer in Asia. So when people are migrating from mainly 100% rice diet to have other things, other grains, beef, other things, the the stomach cancer rate goes down proportionately.
Really, that's
Yeah,
interesting.
anyhow,
Never.
yeah, we'll talk about this thing further later.
Yes.
There are so by definition, heavy metal goes in your body. It just rooted in the fat. It doesn't come out. So it's very difficult to do heavy metal detox because by definition it doesn't come out. There are easier, smarter ways. We eat something that combines with heavy metal stronger than the fat, then it just takes out the heavy metal from fat and then it just goes out. That's an easy way to do the heavy metal detox, right?
Well, I would imagine, but you
Seaweed,
got to know what to eat exactly to do it.
seaweed, seaweed,
Seaweed.
seaweed. So we have a good combination of seaweed, very healthy. Also, you should be careful because this is all many parts of the ocean is contaminated, polluted, and then that's the source of heavy metal. So yes, you should get the proper seaweed from clean ocean. And another the best way to do heavy metal detox is again gut health. Why probiotics is important for our health? Why is it so important for our health? Because probiotics eats heavy metals and it just goes out. That's why that's the whole point of getting probiotics. That's the whole point of gut health. So if you do proper detox using our product or celery and recover the probiotics flora
Mhm.
and this seaweed that sticks to the heavy metal stronger than fat, and then it just goes out of your system very easily. But isn't it better that you prevent from heavy metal from coming in first, right? But for removing, there are ways like that. And then let me tell you, we are selling this thing quite a bit actually, which is very good for allergic patients. So people have allergy. Most of them have heavy metal toxicity in the body. So if you remove the heavy metal, many allergies are just gone. In any way, let me tell you an interesting story. We are producing this product in our Vancouver factory, and then our employees come and talk to me and say, "Oh, Dr. Kim, I like this product." I said, "What do you mean?" And he says, the young people, they just go to drink and then they compete, just drinking competition, right? Who is stronger, right? Many of our employees take our just Kataros, this couple of pills, and go and just drink in competition. They say he won over everybody because this thing combines with the alcohol, it just goes down. You don't get drunk.
Really?
Yeah, but there's a danger. Let me tell you before we go into that topic. Let me here say one danger here. I said it strongly combines heavy metal, right?
Hmm.
But there are a lot of heavy metal in our pharmaceutical drug. So if you take this product with pharmaceutical drugs, there are danger the pharmaceutical drugs stop working. So if you are taking a certain pharmaceutical drugs, I'm not against every pharmaceutical drugs. There are pharmaceutical drugs which is very important. So when you are taking those important pharmaceutical drugs, which many of which contain heavy metals, and if you take this heavy metal detox together, this thing incapacitates this thing. This thing stops having efficacy. This is very dangerous. Sometimes it causes life-threatening danger. Why?
So you got to talk to a consultant. What you're saying is you need to talk to one of your consultants prior to getting on any kind of a metal detox program.
Educating, we are training our consultants very, very seriously. Also, there are in red font. There are many warnings in this product, in this website. So there's no danger people take our product without knowing this. So don't worry about it. We make it sure they are properly warned. But even though this is so natural, the function itself comes with that danger. So basically, if you are taking those pharmaceutical drugs which inherently contain many heavy metals, and if you take seaweeds, same danger is there. You must have heard that the when you are taking a certain drugs, you are not supposed to take a yogurt, because the probiotics inside the yogurt may take the heavy metals out of the drugs, and then it lessens the efficacy of those important life.
I have heard about that with the yogurt.
Yeah. You must have heard of it, right?
Yes, yes, I have.
Lemon too. Lemon
as well.
Yeah, lemon too. Be careful. So, number of drugs which have counteraction with lemon are more than hundreds. Be careful. Yeah. Anyway, so let's wrap this thing up. So basically, I just mentioned there are 4 suggestions I made. I'm just going into the last one. Control your blood glucose. So once you have blood glucose, all this, I told you, the autoimmune diseases needs inflammation to create vicious cycle. So autoimmunity attacks your own organs, and then it has to create inflammation. Once there's an inflammation, more autoimmune diseases. But in order to create inflammation, you need blood glucose. So if you control your blood glucose, even though there is an autoimmune response, the inflammation doesn't happen. So you can live as a normal person without taking all those steroids, all those strong medications. So if you follow these 4 suggestions I just gave you, the chance of your living as a normal person is 70%.
It's incredible.
Yeah, 70%. So there are 30%. I'm encountering so many autoimmune diseases. I'm telling this thing with personal conviction. There are certain cases of autoimmune disease which I don't know, which is about 30%, but 70%. So I ask them, your doctors don't know the cause. I don't know the cause either. But if steroid gives you temporary help, our product works and our suggestion works. So also what we suggest is what are good for your health anyhow. So there are things you should avoid. There are things you should do anyhow for your good health. But the one last caution I'd like to mention is with one exception. With one exception. One, when you don't have healthy gut, what's good for your health becomes a trigger of autoimmune diseases. So those healthy fibers contained in grains, it triggers autoimmune disease. So no matter what, I just I just repeat this thing too much, but all diseases should be treated with restoring gut health first, then treat the next one. So that's why whenever a person contacts our company, we suggest them, please use our detox first, then start other treatment.
Cleanse
Because
the entire system out.
yeah, because if your gut does not absorb good things, what's the point of keep on giving good things there? It doesn't go to your body, right? Yeah.
Well,
So
the cleansing increases the absorption of the product.
another thing is the elderly people in nursing homes. You talk to those people, elderly people. They are complaining, oh, I have a pain here, I have a pain here, I have a pain, I have pain here. All kinds of pains. And what they do at the nursing home is you give painkiller. One kind of painkiller doesn't work, second kind, third kind, fourth kind. And then if that doesn't work out, you just give sleeping pills. So that the not because they care about your sleep, because they don't want to hear your complaint. So you just make you sleep. That's what they do. So 90% of nursing home complaints is pains all over.
Yeah.
You say, hey, cleanse your gut first. I say almost 100% of nursing home complaint of pain disappears. So one painkiller, the most common side effect of pain, complication of painkiller is constipation. Painkiller, so
that's with most drugs, doctor. Every time I went in for an operation and they put me on medication, there was always a constipation, and you had to take a cleanser, some kind of a cleanser to help help release everything.
In a sense, all these pharmaceutical drugs and injections kind of steps in and substitutes our own body's function. So it just stops our healthy digestive process, no matter what, because it just intervenes, and then it just comes into our body and say, hey, you stop and let me do the work. So when the drugs say to our body, you stop, it includes our digestive process. Of course, almost every drug that comes with a complication or side effect of constipation.
Yeah.
Makes sense, right?
Yeah, absolutely. Yeah. Well, you look at autoimmune diseases. We've got colic disease, inflammatory bowel disease, multiple sclerosis, rheumatoid arthritis, cancer. Everything just goes on and on. It all has to do with autoimmune disease.
Yeah. Anyhow, let's go back to our start of this conversation. These viewers are our witnesses. Carl Messina laughed when I said I'm going to win the Nobel Prize, and I'm going to disprove him one way.
I think your tenacity and your knowledge of the human body will prevail. So I think I'm going to side with Dr. Marcus Kai.
There's one big condition for Nobel Prize. You have to be a live person. Yeah, it does. Nobel Prize doesn't give a post-mortem award. Our researcher, if he's still alive, absolutely sure he could have won the Nobel Prize. Our second researcher is being nominated already 5 times already. So, our company has a realistic chance of getting a Nobel Prize.
Oh,
At first.
well deserved.
When I mentioned Nobel Prize, Dr. Kuiper says Nobel Peace Prize. He he ridiculed me. I just took it very painfully. It just broke my heart. But okay,
Well, we'll be the first ones to have a drink with you when that happens, Dr.
let's
Kim.
yeah, let's do that. Okay, that's it
Okay.
for today.
Sounds good, Dr. Kim. I want to thank everyone for
Yeah,
watching today's show, and thank
yeah,
you so much, Dr. Kim.
yeah.
Appreciate all you do.
Okay,
We'll see everybody else on the next Health Forum show. Thank
yeah,
you. Bye bye
yeah.
now.